Hello, everyone. Welcome to the We Win podcast, where women are encouraging women in navigation. It's such a pleasure to have you here with us today. The We Win podcast is powered by Accelerate Her Africa in partnership with the Human Pattern Institute. I am your host, Lolita Ejiofor. Okay, let's get cracking. What does it look like when a woman refuses to choose between science and service, or between clinical excellence and global impact? Our next guest is the answer to that question. Born in Greenville, South Carolina, she studied cultural anthropology and global health at Duke University, a foundation that tells you everything about where her heart was headed. She's currently a hematology fellow at one of the most prestigious medical institutions in the world, Johns Hopkins School of Medicine. But the credentials, as impressive as they are, only tells half her story. Her deepest passion is sickle cell disease, a condition that disproportionately affects people of African descent. And she is on a mission to expand access to curative therapies, not just in the United States, but across low and middle income countries with a particular focus on Sub-Saharan Africa. She's a doctor, a business thinker, and a global health advocate. And she embodies everything this platform celebrates, a woman using her purpose as a compass. Please welcome the remarkable Dr. Ijele Adimora. Hello, Dr. Ijele. It's such a pleasure to have you here with us today. How are you doing?
I'm doing great. Thank you so much for having me.
Great. So looking at your background, it's such a unique mix. You have the high-level medical training from UT Health and Johns Hopkins, but you also took a detour to get an MBA at Dartmouth. I'm really curious about the origin of that decision. Was there a specific moment in your medical training where you felt that just knowing the science wasn't enough and that you needed to understand the business side to truly make a difference?
Yeah, that's such a good question. So absolutely, yes. But just to give you a little background about myself. So I'm Nigerian, born in the States, but very much had a Nigerian upbringing. And so I feel very connected to my Igbo heritage for that reason. And so my parents immigrated to the States with my older brother before I was born, who was born with sickle cell disease. And a large part of the reason why they came to the U.S. is because access to sickle cell care in Nigeria just left a lot to be desired at that time. And so, as somebody who grew up with older siblings with sickle cell, I definitely felt in many ways that medicine had already been decided for me as a career. And that, sometimes you choose certain things and sometimes they choose you, that type of feeling. So making the decision to go to medical school was very easy. And I stepped into the profession very wholeheartedly and willingly. But when I got to medical school, it was pretty clear to me that I wanted to do more, and I wanted more than just the patient-doctor interaction, and that I wanted to make larger systemic changes. And so that kind of led me to start thinking about my own siblings' experience with sickle cell and just wondering, what if our family weren't in the U.S.? How would that change our lives? What would our lives look like? And so while I was in medical school, that led me to design a project about utilization of a drug called hydroxyurea, which is used in sickle cell disease in Nigeria. And so that led me to University College Hospital in Ibadan. So long story short, basically that was the very first time that I had an up close and personal interaction with the Nigerian healthcare system. And for me, that kind of changed everything. I knew that I couldn't just go back to the US and become a doctor and, just retire and have a nice life in the US. I knew that there was something else that I needed to be doing. And I felt like I didn't have the set of skills just from being in medicine to do that. And so applying to the MBA while I was in medical school was kind of a shot in the dark. I wasn't actually sure what I was going to do with it. But in a lot of ways, I figured, if I was able to develop another set of skills, that would help me in the long run. And that was really the impetus behind that decision.
Yeah. To me, it feels as though you were trying to augment the skills and the knowledge you already had in the medical field to ensure that you are a system changer just based on your brother's health experience. And you seeing that firsthand must have driven you to become more focused on being holistic in terms of your approach of changing the system and making a difference.
Absolutely, yeah. I think if you know that about yourself, that you're somebody who likes to solve problems, then inadvertently you're going to end up at the intersection of multiple things. And so it just ended up making sense that I was at the intersection of business and medicine, and it ended up being that set of skills kind of gave me the drive that I needed to actually solve the problem that I wanted to solve.
Yeah. You've mentioned that you're deeply curious about how to provide low-cost healthcare options to systems like ours in Sub-Saharan Africa. From your dual perspective, so wearing both the doctor hat and the business strategist hat, what do you think we often miss when we talk about modernizing healthcare here? Is it just about money, or is there a structural piece we aren't seeing?
Yeah, that's a good question. So I think in many ways, modernizing healthcare requires building infrastructure that it takes to support a modern system, and also doing it with the consideration of the context that you're operating in. So, for example, if we just look at medications, right? There's a reason why there's such limited access to like the newest and latest medications. In the field that I work in hematology, for example, a lot of the drugs, the chemotherapy agents, and all of these new cutting edge agents aren't available in Sub-Saharan Africa. And I think a large part of that has to do with the inability for local systems to have the capacity to meet demand for these types of drugs. In Nigeria, for example, I think one thing that our country has struggled with is being able to build the capacity for actual local production of pharmaceuticals. And that's created a very heavy reliance on foreign imports, which ultimately ends up driving the cost of medications up. And so the result is that you have less availability of drugs that are new and that are modern. And you end up getting higher cost of the drugs that you are able to get. So it's a failure kind of on two fronts. I think a large part of that failure has to do with not only just high upfront costs that it takes to actually manufacture and produce these APIs for medications, but also poor incentive structures to build at scale, and also very little cost sharing efforts by the government to support manufacturing efforts, to support research efforts. And I think similar things can be said about other kinds of systems like electronic medical record systems, medical equipment, and things of that nature. And then I will say that I also think a large part of what's missing from the conversation that maybe people in the business world don't necessarily understand is that the impact of health literacy and education is huge. One thing that I have seen, even from my limited time in Ibadan, for example, when you have a healthcare system that's overburdened with people who are late presenters to care, that's not a sustainable system. So, you have people whose disease could have been cured or could have been caught earlier, but because of limited health literacy, limited health education, they wait until the last minute to come to the doctor. And at that point, not only is their disease more complex, it's more costly to treat, and that's kind of a recipe for disaster. So I think the nice thing about innovation is that it can make up for some of these deficiencies and some of the gaps in infrastructure that the government hasn't taken accountability for. And, that's kind of why I decided that entrepreneurship would be the best route for me.
Yeah. I think you've hit on two major points. So obviously, and this is a common denominator, we do need the government to step in to subsidize these costs because, as you've mentioned, they're very high costs and it actually eats into the availability of some drugs. But also the health education side. So for people to even fully understand and appreciate what the health implications are so they can act quickly and not have to be rushed into the system and it's too late. So yes, those conversations need to happen. So thanks for bringing that to the fore.
Mm-hmm. Yeah, exactly. I think it's a problem also too that we've had for a long time and that has just kind of been an open secret. But now I think, with some of the things that are happening, like with Chimamanda Adichie's unfortunate passing of her son, I think it's drawing a lot more attention and spotlight on some of the things that, we've waited way too long to try to fix. Yeah.
Such a sad situation. You spent time on the ground in Nepal, Tanzania, and South Africa. I'd love for you to take us into those experiences. When you compare the challenges in those regions to what you see in places like Baltimore, are the fundamental problems actually similar or are they completely different worlds?
Yeah, I feel like the fundamental problems are there, but obviously the contexts are different. So in Baltimore, the field that I work in sickle cell disease, it's very obvious that, the U.S. healthcare system isn't perfect either, and that we still also have a lot of work to do in the U.S. to make sure that healthcare is equitable and accessible. And so the fundamental problems, I think, that exist in healthcare, like the fundamental question is, how do we get access to healthcare for everybody? I think that's a question that I don't know that any nation has really solved, but we try to do the best that we can. In Baltimore, it's clear that, there are a lot of social determinants of health, from poverty, poor access to specific services or services concentrated in areas that don't necessarily impact the communities that they seek to impact. There's definitely inequity in terms of, how healthcare resources are allocated. There's also a lot of overspend as well. And also people not being able to afford certain things that they would like to have. So I think in general, like the problems are similar, but the intensity and the level to which these problems are impacting people are different. I think from my time in Nepal, I learned that irrespective of, the outside economic forces and factors that are impacting healthcare, there are still ways to create sustainable models for that specific context. And when I was in Nepal, I worked for an eye hospital called the Tilganga Institute of Ophthalmology. And that was the first foray that I had into realizing that there are different ways to design healthcare systems. Not everything has to be based on like a US or a Western model. And so that's where kind of that low cost, high quality healthcare model for me came into the picture, and that they were able to provide free healthcare to people who had nothing by charging people who had a higher willingness to pay a smaller amount. So it was almost kind of an innovative way of doing socialized medicine. And there are different innovative pay structures and things like that all around, examples of that all around the world. But I would say that fundamentally, the problems that we have are the same, but the resources that we have to fix those problems are what's different.
What's interesting about Nepal is their approach of making it a social, impactful system. So you charge the patients who can afford so that you can provide healthcare for those who have nothing. And context is really important. So that context is different from what you would have in the States. But you still mentioned that there are still problems of inequity and accessibility to the best healthcare. It's still a global issue, but I think what you mentioned there is just finding innovative ways to address the healthcare and the access to it in the region that you're in.
Yeah, absolutely. I think that you try to concentrate your efforts and your skills in the best way that you can to solve the one problem that you think is really important. And to me, I feel like the problem that our company is trying to solve is affordability of medications. I think it's one of the lowest hanging fruit to solve, just being able to get people the medications that they need.
Absolutely.
I do think that, one, it helps with, preventing illness and also treating things before they become too dire. And so that's kind of the essence behind our company. For example, we know that in Nigeria, most people are paying, like 75% of people are paying fully out of pocket for all of their healthcare needs, which I think is just, it's not a sustainable thing. Like, I can't imagine. Can you imagine if you needed a CT scan? And a CT scan in the US costs maybe $2,000. I don't know how I would be able to pay fully out of pocket for something like that in Nigeria, but, people do. And I think it's a huge burden. So if we could alleviate even some of that burden by making sure that their medications are lower cost, I think that would be a welcome relief for a lot of Nigerians and also improve healthcare outcomes. And so we know that, ultimately, many people, because of this, are not able to afford the medications they need, and that leads them to forego buying medications at all. And so by reducing the price of medications, we're able to, one, get patients the medications they need at an affordable price, and two, also drive demand, drive sales and revenue for community pharmacy owners. So it's essentially kind of offering almost like a stimulus package into the healthcare system in a way of providing almost like a micro-insurance model, a shareable cost model at scale. So that's what we're hoping to do with our product, Well Wallet.
That is so commendable, and it's so much needed in societies and countries like Nigeria, where accessibility to drugs is prevented because of these high costs. You mentioned the cost of a CT scan in the US costing up to $2,000, and paying out of pocket would be almost unsustainable. But, in societies like ours, we end up having these people manufacturing fake drugs. So how would you say your organization is competing with that?
Yeah, it's a really good question. So we work and we partner with community pharmacy owners. These are licensed community pharmacy owners who are selling products according to NAFDAC regulations. And so we vet all of our community pharmacy owners beforehand. They have an agreement with us. Well, first of all, we have that trust with them that they're selling legitimate products. And we also have an agreement that, anyone who's carrying anything even beyond their expiry dates, that would not be a pharmacy that we would have on our platform. So we know that there are good people out there who are trying to do the right thing for patients, good community pharmacy owners, licensed pharmacists who want to do the right thing by patients. So that's who we decide to partner with. I think also Nigeria has made some strides in terms of cracking down on counterfeit medications, although there's still a large way to go. But that kind of also creates a better, regulatory environment for us to do business as well. So it's a combination of having trusted partners to work with and doing the homework and vetting the pharmacies, and also pushing for better policies as well at the federal level to prevent, the more systemic issues that maybe even the community pharmacy owners can't control.
Of course. Okay, so I want to ask you about a fascinating paper you published regarding sickle cell disease. The findings seem to suggest that a patient's address matters almost as much as their prescription. Can you walk us through that study? What did you discover about the relationship between a child's neighborhood and their health, even when they are taking the right medication?
Yeah, thank you for bringing this up. This is a really fascinating study that I did when I was a resident in Texas. So what we found is that we looked at a population of children in Texas who had sickle cell disease and who were on a medication called hydroxyurea, which is the only FDA-approved medication for sickle cell disease right now. So what we found is that among children who were adherent to their medications, and we have different ways of being able to validate adherency, what we found is that even among people who were taking their medications every day, that where they lived effectively determined how well their disease was controlled. And so it almost suggests that based on other kind of psychosocial determinants, poverty, we looked at something called the Area Deprivation Index, which looks at poverty, zip code. It's a score that weighs 8 different psychosocial determinants of health, where we saw that among the population of patients who were living in the more deprived zip codes, that they had poorer responses to their medications than the people who were living in places that were less deprived. So it does kind of suggest that even if you do everything right, take your medication every day, there are still other factors, other stressors that can impact your disease trajectory.
That's a very valid insight you just shared. It's not just where you live. It can depend on the life you live, so your lifestyle, that has an impact on how well you get, even though you're taking your medication.
Yeah, exactly.
Okay, so this brings us to a specific term you used in the research, the Area Deprivation Index. For those of us who aren't in public health, could you introduce this concept to us? What exactly is it measuring, and why is it such a critical tool for understanding why a patient might not be getting better?
Yeah, so the Area Deprivation Index, it is a score. It's been validated in other public health studies. Weights or assigns a weight to all of the different kind of social determinants of health. So it looks just not at geography. It looks at things like access to healthcare facilities. It looks at specific zip codes. So one thing that it looks at is like the amount of like smog in your area or other pollutants, environmental pollutants, things of this nature. So it's really a way of stratifying by geography and by access to resources what might be the factors that might be lacking outside of medications and medicines, that what are the factors that might be lacking that are contributing to someone's overall health outcomes. And so it's a really great tool to help us understand a little bit more about our patients besides just the numbers that they have or, their medical record. We can understand kind of a little bit more at a granular level what our patients are experiencing on a day-to-day basis.
Yeah, you said it. It's a great tool. And what it's helping to do is pinpoint those other areas which could be impacting the recovery of patients or how sick they're getting. Okay, so sickle cell has historically received less attention than other genetic disorders. I wonder how this lands for you personally, standing in the intersection of being a Nigerian American woman and a researcher at a top institution like Johns Hopkins. Do you feel a sense of personal responsibility to be the voice for this specific patient population?
Yeah, well, I don't know that I could ever truly be the voice for my patients, but what I would like is to be at the very least an amplifier of their experiences. So I totally agree with you that I think, sickle cell has been neglected in the medical community for such a long time. It was the first genetic disease that was ever kind of discovered. And till now, we really don't have a lot of options for management of sickle cell disease. And this is largely because it affects Black and Brown people in the US and it affects Black and Brown people around the world. But I think that society has, and also the hematology community has certainly become more receptive to the idea that we need to be making more progress in this field, and that it's a shame how much progress we could have made compared to where we are right now. But I do think that there is a lot of great research that's coming down the pipeline, some of which I'm part of. Yeah, that just gives families like mine a lot more hope. I think that is the reason behind the explosion of things like gene therapy and transplant and other curative therapies. But we still have a lot more work to do in terms of, there are a lot of patients who don't qualify for gene therapy, don't qualify for curative therapies, and we need medications to treat those patients as well. And likewise in Nigeria, there's so much work that needs to be done, not only from the research level and getting newer drugs down the pipeline and getting access to clinical trials in Sub-Saharan Africa, but also just getting people the very basics, like hydroxyurea is still not widely available, even though it's been used for over 5 decades in the US. That's something that I think is unacceptable. And just being able to kind of push the needle forward as much as we can through innovation, I think is really important. And finally, addressing like stigma. I think stigma is still such a huge thing in Nigeria for sickle cell patients. And the more that the community at large can help advocate for them, I think the better. And the more open conversations that we can have, the better as well.
Yeah, you've touched on a really valid point there. It is a disease associated with Black and brown, and the community who experience that should find people who would, like you, Ijele, you have sickle cell in your family. You're taking it up as a cause to find innovative ways to either prevent the disease or cure it altogether. So it is a community responsibility.
Yeah, absolutely. I think there's been so much work at a community level in advocacy in the US, in the UK, in Nigeria, and a lot of that is driven by patients and their families. So I'm coming into the field now as somebody who is benefiting from the work that other people have done and the suffering that other people have had to go through to even get sickle cell mentioned and get it in the spotlight. Like I think there was like a recent New York Times article about a patient who had been cured, a young man who had been cured of sickle cell through gene therapy. That article could have never come out even 5 years ago, 10 years ago. Do you know what I mean? So I think there's a lot of progress that has been made, but we always just have to keep trying to push the needle forward.
Yeah, there's so much hope there, you've put out there, and I'm so glad that you're on the case. I've been looking at some of your case reports on rare conditions like TTP, where the symptoms look like a stroke or leukemia. It sounds like high-stakes detective work. Can you take us inside that moment? When a patient is deteriorating and the answer isn't obvious, how do you navigate that uncertainty without losing your cool?
That's a great question. Yeah, and that's still something that I'm navigating as a young medical professional. Yeah, it can be really challenging when you have a patient that you feel, responsible for. And just in the field that I work in, there's a lot of morbidity and mortality, unfortunately, because we work with patients that are really sick. And you get to know them, you get to know their families, you meet their families, you talk with them, and sometimes things still don't go as you would hope. And so that can be really crushing. But I think, it's just trying to show up every day and do the best that you can. And to stay curious, I think, is really important. To never take things completely at face value. That's something that I've definitely learned as a doctor. Sometimes things can surprise you and you have to be ready. You have to kind of at least have thought about all the possible things that could happen or that might happen to somebody, even if the answer seems obvious. So staying curious and staying thoughtful has really helped me. And I think also too, just realizing and recognizing there are certain things that are completely out of your control as well, and not to beat yourself up about not catching things earlier or, not seeing all the signs and things like that. Because sometimes, there just isn't a way that you would have known that a certain outcome was going to happen. And it does take a lot of acceptance that things are out of your control.
Yeah.
And also just reliance on God too. That has helped me a lot. And I try to pray as much as I can when I go to the hospital or I'm taking care of patients overnight. Like just that, I have the insight and the wisdom to be able to take care of them as best as possible. So all of those things, they help to calm me down a bit.
Yeah, I can understand completely. You know, the composure and curiosity you speak of is a necessary survival skill. But I want to ask about the cost. As women, we're often socialized to be the nurturers, to absorb the emotion in the room so others don't have to. When you finally take off that white coat after a heavy shift, where does that emotion go? Is it hard to stop being the shock absorber and just be your vulnerable self?
That's a good question. Sometimes it is. I think sometimes it is really hard to decompress after work or after carrying things. It can be really tough. But I've learned that I also have to prioritize myself to be able to show up the next day as good as I can for the next person. And so that does kind of involve like me shutting my brain off at the end of the day and doing something relaxing, taking the time that I need for myself to just not do anything. Even if my to-do list at the end of the day is still, there's 20 items on it, I just have to set that aside and tell myself, okay, I need this time to recover and recuperate. And this time is as valuable as the time that I'm spending at work as well. Because it's really difficult to show up as your best self when you haven't given yourself enough time to rest. It's one of those lessons that I think I will learn for my entire life. Like it'll take my entire life to learn. But it is important to also prioritize yourself as best as you can to be able to show up to do the work. So what that looks like for me is just blocking off some time. Sometimes I will block off time in my calendar. I also have specific things I do on certain days to prepare myself mentally for the week, whether that's like listening to music or cooking myself like a nice dinner or preparing, food for the week, that type of thing. Things that help me to stay structured, but also to stay a little bit more relaxed as well. So, but yeah, I'm definitely a work in progress in terms of being able to turn off my brain at the end of the day.
That's so good to hear that you do make time to rest because, the next thing is you burn out and you can't pour into others what you don't have.
Yeah, absolutely. I think also to rest, self-care and rest, I think what I realized this past year is that the more intentional I am with my time and the better that I use my time, the more time I actually have to rest. So being intentional, saying no more, structuring my day in a way that I'm able to kind of get the things that I absolutely need to get done. So I'm not dwelling on it at the end of the day. That definitely helps me rest and prioritize time for self-care too.
Yes. You mentioned an interest in pharmacotherapy interventions in Ibadan. I know many medical professionals in Diaspora are looking for ways to give back, but it can be hard to know where to start. Based on your experience, how would you advise someone abroad to engage with the Nigerian system in a way that is actually helpful?
That's a good question. Again, I think it goes back to understanding what your skill set is and how you can add value. So, for me, I feel like I'm someone who's naturally kind of more big picture thinking and likes to solve problems that I feel like are bigger that will make an impact on a lot of people, but not everybody is that type of thinker. And I think we need people who are different types of thinkers all the way in every part of the healthcare ecosystem in Nigeria, in Sub-Saharan Africa at large. So I think, it goes back to knowing what it is that you feel like you really want to do and what do you have the skill set to do. And for me, I felt like ways that I could make an impact by creating economic opportunity were things that I wanted to prioritize. And that's why I went into business, because I think business uplifts us in two ways. One, it solves a problem, it caters to a need, but it also injects revenue into the ecosystem. So people are more economically able to fend for themselves. But I also think that charitable efforts are good as well. Like I know so many people that are working in that space who are just providing healthcare screenings for free to people, like blood pressure screenings, diabetes screenings, who are providing women's health services for free to people. Those are the kind of low-hanging fruit that we also really need. And for people that are in dire need, something is better than nothing. So it just depends on where you kind of see yourself in, the value chain of being able to provide something. I think everybody can fundamentally do something. It just is a question of, where do you think that you are best served?
So in the practical sense, if we're looking at our audience today who have this skill set, who have something to offer, would you say that you would be open to partnering with some of these people to build a wider ecosystem of support to drive your mission in Nigeria?
Oh, absolutely. Yeah. So we are always looking for community pharmacists to partner with. So if community pharmacists are interested in our platform, they can go to mywellwallet.com and sign up. And then in addition, having a network of people is always better than going solo or flying alone. So I've definitely tapped into the networks that I've been able to create in Nigeria, or to join and be a part of in Nigeria, just to even talk with people and say, I'm working on this. What are you working on? How can we collaborate and work together? Because it's always better to collaborate than to reinvent the wheel, in my opinion. Correct. And I think if people are interested, they should interested in solving this problem of medication affordability, or interested in solving problems related to medication at large, they should definitely reach out. And we would love to work with other founders and other startup owners who are curious and wanting to solve a problem as well.
Yeah, perfect. Okay, so Dr. Ijele, as we wrap up, I want to look back at the start of your journey. If you could sit down with the younger version of yourself starting medical school, knowing everything you know now about the intersection of poverty, business, and health, what is the one thing you would tell her to pay closer attention to?
That's such a great final question. One of the things that I think I would tell my younger self is to pay attention to the things that are right in front of you, to be honest. So, like I mentioned, I do feel like in many ways my story has kind of written itself, and the elements of what I was supposed to do were there all along. And I think I wish I would have trusted myself more to find the answer. And leaning on kind of that inner voice that's always kind of been there, guiding me and directing me. In terms of what to do, I think is an important strategy for me and for everybody. I think we all have a story, and if you pay attention to exactly what's in front of you, you'll be able to progress in that direction. And a lot of the times, I think it writes itself. Yeah, I'm happy that I've finally gotten to the point where I can feel acceptance of all the intersections that I've had to go through to get to this point. A lot of the times, the path is not completely clear and laid out. But if you kind of follow what it is that inner voice that is always there, if you stop and pay attention to it, you'll realize that life is not about choosing the path that seems the most easy. It's about choosing the path is the most right and purposeful for your life. And a lot of the times that involves taking a detour, or taking a journey, or being at the intersection of two things that seemingly don't make sense. And it's just something that I've learned to accept and grow into. And a large part of the time, once you grow into that, it finishes on its own. So I think if I could tell myself that as a medical student, then I wouldn't have spent so much time worrying.
That sounds so lovely. Your journey has been so profoundly purposeful, and it's never linear. It's always these detours. And I think you've come to the point where you are now very much knowledgeable, and you're a practical person. You're not just finding out all this information, but you're in the front end advocating and pushing. So you're doing a great job. And I would love to say I've enjoyed your episode so much. And thanks again for joining us here to tell your story and give us so many insights about sickle cell and the work you do.
No, yeah, it's been great talking to you. Thank you so much. And I really admire what you're doing as well. So thank you for giving me the opportunity to even share my story on your platform. I really appreciate it.
What can I say? Dr. Ijele has spent time with us sharing her intentional journey and how she's driven by personal circumstances, and she hasn't stopped. This lady is writing papers. She's doing the research and she's writing papers to share her insights. And in the front end, she's advocating and pushing for communities to help solve the problem of sickle cell. She's also coming back home to make sure that healthcare is more affordable and more accessible to her people. And that is purpose, guys. So I want everyone to think about their journey and consider what impact it's making on others, and reflect on how you can be more practical and more intentional how you go about that journey. I would like to say a huge thank you to all of you for listening in today. And, try and spend some time thinking about this question. I exist to ... Fill in that gap. You can do it today, tomorrow, but think about it.